Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Hi everyone, I'm Ifeanyi from iHelp Nigeria Initiative. Welcome to another episode of In-Depth Eye Health podcast series. Our topic today is when a child has cataract.
Hi everyone, I'm Mustafa Bature. Our guest is Dr. Mary Ugalahi, a consultant ophthalmologist and pediatric specialist at the University College Hospital, Ibadan. Nice to have you with us, ma'am.
Thank you very much. I'm glad to be here.
Welcome, ma'am. We know cataract is quite common among elderly people. How can one know when a child has cataract?
All right. To respond to that question, first of all, I would like to say what a cataract is. And a cataract is an opacity of a portion of the eye that is called the lens. This part of the eye is one of the areas that is very important for the child or any individual to see clearly. So when it becomes white, we say the person has a cataract. So for someone to know if a child has a cataract, you may notice a white speck in one eye or both eyes. Also, the behavior of the child can give us some information that this child may not be seeing very well. We may not be sure that the child has a cataract, but it may be a pointer to the fact that the child may not be seeing very well. If a child is tilting the head to read, if a child is tries to squint the eyes, it's like straining to see. So it sort of make the lids tinier so they can see. Or the child is very clumsy, always falling, bumping into things, and having difficulty with schoolwork. That may be suggestive that the child has a cataract if it's an older child. If it is a baby, the child may not be looking at the mother's face during breastfeeding. So that may be suggestive that there's something wrong with the vision of that child. And the definitive knowing is when the child sees the doctor.
It seems cataract has so many consequences. What are the common causes of childhood cataract in our environment?
Okay. I'll divide the causes into two broad groups because cataract can occur, a child can be born with cataract and cataract can develop later in childhood. So for those children born with cataract, some of the common causes are infection within the womb. If the mother maybe has some form of infection, we call this infection touches. It represents a group of organisms that can cause infection in the womb. One of them that is very important is the rubella virus. So that's one cause. The other ones, other maternal factors, like maybe a mother who has diabetes or who was on some medications while pregnant or exposed to radiation. Other things like some hereditary causes or some syndromes, like a child who has Down syndrome may have cataract. Now in older children, some of the common causes are trauma and injury to the eye, or the cataract may be something that has been passed down from a parent to the child, and the child can develop a cataract later in life. Or if the child has some kind of inflammation within the eye, what we call uveitis, that's one other possible cause of cataract in children.
Thank you very much, Ma. So for a child that has developed cataract, what are the management options?
Yeah, in children and in most people, even in adults, the definitive management for cataract is surgery. Now, what is very important about the treatment for children is that surgery has to be done, whether the cataract is mature or is not mature. So the definitive treatment for cataract is surgery.
What happens if the treatment is not commenced early?
Thank you very much for this question. This is the most important part of treatment in children, time. In an older person, he may have cataract, and you say, let me go and have a village meeting, or let me go and tell my people, or let me go and think about it and all of that. But in children, that cataract blocks vision. It doesn't allow the vision of the child to develop. Because as a child is growing, learning to walk, learning to talk, learning to run, the eyes also learn to see. So if there's a cataract in the eye, it blocks the ability of the eye to see. So now that I've said all of that, if we don't operate the cataract on time, what happens? The eyes never learn to see. So if the child is now operated at a later time in life, or when the child is older, that eye never learned to see. So there's something we called lazy eye or amblyopia in the medical term, but in the layman term, lazy eye. It causes an irreversible blindness. So that even after removal of the cataract, that child is unable to see because the eyes never learned to see. So it's always a matter of urgency when a child is diagnosed with cataract. There is no time to delay. Surgery must be done immediately, because if surgery is not done at that time when the child is still learning to see, those eyes never learn to see and the child becomes blind even after surgery later in life.
Thank you. So time is very important. Time is of essence whenever a child has cataract. So what's your final piece of advice for listeners about cataracts in children generally?
Yes, in our environment, cataract is one of the common causes of blindness in children. Though it is not a common thing, but whenever it occurs, the impact of that cataract on the life of the individual is a lot. So my general advice to everyone is that if you identify a child who has cataract, it is important that that child has treatment at the time that is required. There is no child that is too young to be operated. There is no age that is too early to operate a child. Treatment is easy and not difficult. And the right time for treatment is now, not later.
Thank you so much, Ma. The message is loud and clear. We appreciate your expert insight on this interesting topic. It has been a pleasure having you on the program today.
Thank you very much. I'm glad to be here.
August is Children's Eye Health and Safety Month, and our focus for this episode is cataracts in children. Cataract occurs as an opacification of the usually transparent lens of the eye. This can appear as a white speck in a child's eye. Cataract is one of the leading causes of blindness in children, and it can affect one or both eyes. Treatment for cataract is surgery. A child that has cataract should see an ophthalmologist as soon as possible. If not detected and treated early, cataract can cause irreversible blindness in a child. Remember, a white speck in a child's eye is never a good thing. It could be cataract.